Hello, I'm Dr. Anya Sharma. And today, we're going to talk about something incredibly important yet often overlooked, the health of your neck. Specifically, we'll discuss the thyroid gland and how a simple self-check you can do at home could be a crucial first step in detecting potential issues early. Your neck is more than just a bridge between your head and your body. It houses vital structures, including your thyroid gland. This small butterfly-shaped gland sits at the front of your neck, just below your Adam's apple, and it plays a huge role in your overall health. It produces hormones that regulate your metabolism, heart rate, body temperature, and even your mood. When your thyroid isn't functioning correctly, it can affect your entire body. Now, why is a neck self-check so important? Thyroid conditions are surprisingly common, affecting millions of people worldwide. These can range from an underactive or overactive thyroid to thyroid nodules, which are lumps that can form within the gland. While most nodules are benign, meaning they aren't cancerous, a small percentage can be. The good news is that when thyroid cancer is detected early, the prognosis is excellent. That's where you come in. By becoming familiar with the normal feel and appearance of your neck, you empower yourself to notice any changes, like a new lump or swelling. This simple act of self-awareness can be a lifesaver. It's not about self-diagnosing. It's about being proactive and knowing when to seek professional medical advice. Think of it like a regular check-in with your own body. So, let's get started. Before we begin the actual check, let's gather what you'll need. It's very simple, just a handheld mirror and a glass of water. That's it. Find a comfortable, well-lit space where you can see your neck clearly. The purpose of the water is to help you swallow. Swallowing causes your thyroid gland to move up and down, making it easier to see and feel any potential abnormalities. This technique is used by doctors during a physical examination, and it's something you can easily replicate at home. Make sure you are relaxed. Take a deep breath. This process should not be stressful. It's a quick, easy routine you can incorporate into your monthly health checks. Are you ready? Let's walk through it together, step by step. First, hold the mirror in your hand and position it so you have a clear view of the front of your neck, specifically the area between your collarbone and your Adam's apple. Your thyroid is located in this lower front portion of your neck. Tilt your head back slightly, but not too far. You just want to stretch the skin a little to get a better view. Now, take a sip of water. As you swallow, keep your eyes focused on your neck in the mirror. Watch for any bulges, protrusions, or lumps in the area of your thyroid as it moves up and down. The thyroid gland will rise with the cartilage as you swallow and then return to its resting position. Repeat this a couple of times. Take another sip of water, and as you swallow, watch carefully. Do you see anything unusual? Remember, you're looking for any asymmetry or distinct lumps that appear as you swallow. Now for the second part of the check, which involves touch. Using the pads of your fingers, not the tips, gently feel the area where your thyroid is. You can use your right hand to check the left side of your thyroid, and your left hand to check the right side. Keep your head in a neutral position or slightly tilted forward to relax the neck muscles. Gently press and roll your fingers over the entire area. You're feeling for any lumps, nodules, or tenderness. The texture should feel relatively smooth and consistent. Again, take a sip of water and swallow. As you do, feel the thyroid gland moving under your fingers. This can help you distinguish the thyroid tissue from the surrounding muscles. Does it feel smooth? Or do you notice any distinct bumps or firm spots? Don't press too hard. A gentle but firm touch is all that's needed. Familiarize yourself with how your own neck feels. So, what are you looking for exactly? A new lump or swelling is the most common sign. This could feel like a small, hard pea, or a larger, more diffuse bulge. You might also notice persistent tenderness in one area, or perhaps one side of your neck appears larger than the other. Sometimes, a change in your voice, like persistent hoarseness, can be a symptom. As the nerves controlling your vocal cords run close to the thyroid, difficulty swallowing, or a constant feeling of something being stuck in your throat can also be related. It's important to understand that finding a lump does not automatically mean you have cancer. The vast majority of thyroid nodules are benign. They could be fluid-filled cysts or just an overgrowth of normal thyroid tissue. However, any new or changing lump in your neck should always be evaluated by a healthcare professional. Do not ignore it. If you do find a lump or notice any of the symptoms we've discussed, the most important thing is not to panic. The next step is simple. Make an appointment with your doctor. They will be able to perform a thorough physical examination and ask you more detailed questions about your health. Based on their findings, they may recommend further tests. This could include blood tests to check your thyroid hormone levels or an ultrasound of your neck. An ultrasound is a painless imaging test that uses sound waves to create a picture of your thyroid, allowing your doctor to see the size and characteristics of any nodules. If a nodule looks suspicious, they might suggest a fine needle aspiration biopsy, where a very thin needle is used to take a small sample of cells for analysis. This is the most definitive way to determine if a nodule is cancerous or benign. Remember, early detection leads to the best outcomes. Let's recap the process. Once a month, stand in front of a mirror, tilt your head back slightly, take a sip of water, and as you swallow, watch your neck for any lumps or bulges. Then, gently feel your neck for any nodules or tenderness. It takes less than a minute. By making this a regular habit, you are taking an active role in your health. This is about empowerment. It's about being informed and attentive to your body's signals. It's not about creating anxiety but about fostering a sense of control and partnership with your healthcare providers. Share this information with your loved ones too. Encourage your family and friends to perform this simple check. Awareness is a powerful tool, and by spreading it, we can help ensure that more people catch potential issues early. Your health is your most valuable asset, and investing a few moments each month to protect it is one of the smartest decisions you can make. Please remember, this self-check is a screening tool, not a diagnostic one. It's a way to spot potential warning signs. It does not replace regular checkups with your doctor. If you have a family history of thyroid disease, or if you've had radiation therapy to your head or neck in the past, you may be at a higher risk, and it's even more important to be vigilant and discuss your concerns with your doctor. Your doctor is your best resource for personalized medical advice. Thank you for taking the time to learn about this important health check today. Taking care of yourself is a journey, and every small step counts. I hope you feel empowered to add this simple routine to your life. For more health information, be sure to subscribe to our channel. Stay well, and take care.